big and small medical situations that could happen while in the wilderness. So this is my presentation from Unit 7, Activity 1, and my video is for, I believe, Activity 2, but I could be mistaken. Okay, so first I have wounds. This is mostly small wounds because it's abrasions and contusions. Abrasions is mostly when the skin breaks, so like a scrape or a cut would be an abrasion. And for those, you would want to clean it with water, like clean water, and pretty much just cover it if possible, but you want to make sure everything is clean is the number one priority. And then for contusions, which could be bruises, usually from force, you would want to apply ice if possible, but basically that one is more just about pain and swelling than it is about risk of infection. So for contusions, you just want to keep it cool and comfortable, whereas abrasions, you want to keep it clean. Next I have severe bleeding. So this would be arterial or venomous. I'm actually not sure. I'm sure it's venomous. I'm so sorry. For this one, you are going to want to use something clean to give constant and hard pressure. I think it's pretty common knowledge that for severe bleeding, you want to keep pressure on it if possible to slow the blood loss. But for severe bleeding, you definitely want to call for extra help, especially if you're by yourself in the wilderness. You definitely need to call help. And then for the most severe, usually, you could use a tourniquet, but tourniquets are usually for like the most severe thing. So I would just say use hard pressure for this type of wound. Next, tourniquets. These are only used in the most life-threatening situations on arms or legs because they're extremely painful and they can cause a lot of harm if not used correctly in necessary situations. So to use a tourniquet, you have to place it, so for instance, if my wound was on my arm right here, you'd have to place it above the wound, and you have to tighten it as much as possible. There are tourniquets in this room with me, but I am not going to grab one right now. You want to place it as high and tight above the wound as you see fit, and you tighten it until the bleeding stops. You want to mark the time that you start using the tourniquet, and then you want to mark the time that you stop because it can cause limbs to die. But tourniquets are only used in the most necessary medically situations because they can be very dangerous. Also, shock often happens in cases that need tourniquets and with the use of tourniquets, so you also want to watch for signs of shock, and obviously you need to call for additional help if you're in the wilderness and someone has a wound in need of a tourniquet. Okay, so next I'm going to be talking about shock. So shock, I'm so sorry, I wrote this a while ago. It can be shown as cool, pale, and clammy skin oftentimes, as well as, I don't know if I wrote this, but you can have a weaker pulse, and also sometimes an altered state of mind happens with shock. You're going to want to use blankets or extra clothing because of hypothermia, oxygen if it's available, but it's probably not because we're talking about the wilderness, and do not use food or water because in a state of shock, your airway can be vulnerable and you don't want to be choking on anything, or if you're in need of surgery later, you don't want to be full of food and water, because in cases of shock, you're also probably going to need to call for extra help. Next, fractures. Okay, so the types of fractures is closed and open fractures, as I have there. Closed fractures is when the bone breaks inside the body and does not puncture through the skin, and open fractures is when the bone does puncture the skin and you can see it. Okay, so in the case of pretty much all fractures, it really does vary by position and the degree of the break. You're going to want to keep it splinted unless the limb has died, which also can happen, you're always going to want to splint the limb if possible because that is the best way to prevent it getting further injured. So always splint fractures if you can. Splinting and CMS, you have to check circulation. We know what circulation is, motor function in the fingers or the toes, depending on where the injury is, and then you're going to want to take note of the sensory skills that a patient has, because you can lose your sight or your touch, or pretty much you can just, like, your mental status can become altered, which can affect your sensory and neurological capabilities. So to use a splint, you have to apply this splint with a rigid object. A lot of people use rulers, but if you're in the wilderness, obviously you're going to have to use what you can. Sorry about that. And you're going to want to immobilize the limbs with the splint. I have a little picture right there, but yeah. I learned how to use a splint a little while ago, but I learned a lot more about it in Unit 7. So that's my presentation. It's a little bit too long, I'm sorry about that, but that is my presentation on managing first aid in the wilderness.